Thank you for joining us for our Alumni webinar series. I am Amy McCarthy, the Alumni Relations and Data Officer in the Fundraising and Alumni team here at York St John University. Today, I am hosting this webinar as part of the York St John Alumni series, Alumni Journeys, Creativity, Careers and Community. Before I introduce today's speaker, there are a few housekeeping matters. Firstly, we will be hosting a Q&A at the end of the talk. The questions have been prepared in advance, but if you have any questions you would like to ask the speaker, please email alumni@yorksj.ac.uk and the team will pass on your questions. There is also an auto transcript appearing during the talk for increased accessibility. However, please be aware it may not translate perfectly. Thank you. So, I would like to introduce to you Benji Hamilton-Rhys. So Benji is a physiotherapy graduate from York St John University and completed his degree in 2023. Since graduating, Benji has worked as a physiotherapist in the NHS and is currently a respiratory specialist physiotherapist. During his time at York St John, Benji was the Vice President and Squad Captain for the York St John Boat Club. So, I would now like to pass you over to Benji and I look forward to chatting afterwards.
Great stuff. Thanks, Amy. Hi, everyone. As Amy said, my name's Benji, and I was at YSJ from 2020 to 2023 as a physio student, and had a big involvement with the boat club as well, which has been brilliant. My journey to YSJ is perhaps a little bit unusual. I'm a mature student. I started uni when I was 37, in a crazy fit of I'm done with this, I want to do something different. And in the middle of a pandemic as well, which was certainly interesting. So early in life, I'd gone to university, I studied a degree in law, and worked in the legal sector for quite a while. And honestly, I just woke up one day and thought, I've just had enough of this. I need to do something different. I need to do something that really makes me tick and switches me on. And I've always been a people person. And then just before the pandemic started, I thought, I'm going to go be a nurse. It's something I've always thought about and something I've always thought I should do. And so I kind of started that journey, and I started working with a major trauma centre in London in critical care. And then the pandemic hit and everything changed. And I know it changed for everybody, didn't it? The world was just a completely different place. And all of a sudden, intensive care got so much harder. And as much as I loved the work that I did, and I'm really proud of myself and all of the people that I worked with, I kind of realized in an instant almost that actually nursing wasn't for me. You know, I love the job, but I think and still think that I'm just not strong enough to be a nurse. But really interestingly, during that period, I was working with a physio student, and I'd met a respiratory physiotherapist, and kind of in passing and on those moments where we did have just a little bit of downtime, kind of started inquiring about what a respiratory physiotherapist was. You know, I didn't realize it was a thing. I thought we all just kind of did, you know, football and poorly shoulders and bad ankles. And actually, there's a whole world of physiotherapy out there that I didn't know at the time. And maybe a little bit whimsically, I decided, actually, no, I'm going to be a physiotherapist. And so I applied to YSJ and came up for an interview. And after the interview, I walked over the bridge, Glendale Bridge, which we all know, and I looked down at the river and thought, if there's anything that's going to make this work, it's the rowing. You know, I've been a rower for a long time now. It's a huge part of my life. And during COVID, it was the only relief I had. And honestly, I chose YSJ based on the river and the two boathouses either side. A boat just came rowing past me, and I thought, I want to be in that boat. And so I did my last shift at the hospital. I went into isolation for a few days and then just came straight up to York. I'd only been once. I didn't know anybody. I didn't even have a chance to check the accommodation I'd moved into. It was just all very quick and very happening. And the next day, I started my course as a student physiotherapist. And it all went from there. And honestly, it's been such a fantastic experience for me. I loved the way that YSJ delivered the program. It's structured a little bit differently to kind of to more traditional programs, I think. It's much more hands-on, it's much more experiential. All of the tutors on the program are brilliant, and we do some excellent units. And my cohorts is honestly the best bunch of people I've ever had the pleasure of working with, and I'm still close to a lot of people. And then add the boat club into that as well. It's just been phenomenal. So there was a bit of a restriction on rowing, obviously, because of COVID. And I got in touch with the boat club a few times with kind of like, hi, I'm an old man, but I've been rowing for ages and I can also coach, and please put me in a boat. And eventually, you know, I got involved, and I started coaching and coxing initially, and realized that there was not really a good, strong structure with the boat club. And I think because of a lack of support, rowing's quite an unusual sport. You know, it's not football, it's not rugby, and all of the other big sports that YSJ do. But knowing how much of an impact rowing can have on people, I really wanted to push forwards. And so I started as a captain, and just kind of, you know, bringing the squad back together and getting us back on the water and doing things. And then just slowly edged my way through the structure of the boat club and the university, and fast forward 3 years, we'd achieved some phenomenal things. We'd raced more than we'd ever raced. We'd won more than we'd ever won. We'd entered ourselves into books for the first time in maybe 15, 20 years, I think. And we'd sent a women's crew to Women's Henley for the first time in the history of the boat club. And we are the oldest club at YSJ. You know, we've been in existence since 1852. So that's quite significant. And one of the best moments at York, if not the standout moment at YSJ, was the 2023 Sports Awards. We'd put entries through to every single award category. And on awards night, we won every single category that we were shortlisted for. And then another award on top that had to be created for an outstanding achievement for the boat club. And that was just absolutely phenomenal. I'm going to talk about rowing all the way through this, so apologies if you're not into rowing. Hopefully I can kind of spark a bit of curiosity and get you into a boat at the boat club. I highly recommend it. I'll also talk about physiotherapy and my career. So YSJ Physiotherapy, 3-year course with some brilliant modules, and kind of splits itself into the distinct disciplines of physiotherapy. So kind of the more traditional understanding of physiotherapy, the MSK option, you know, the musculoskeletal. Then there's a big respiratory component and a little bit of cardiovascular support as well. So kind of, you know, the more traditional cardiology things that we think, and cardiac rehab. And then the neurological aspects of physiotherapy, which is really interesting. And then there's some modules that are kind of preparing you for academic practice, so things like research methods. There's some preparedness for practice modules that were kind of latched onto the end, and, you know, the dissertational research project that we do as well. It really is such a well-structured course. It's brilliant, and it set me up. We have, as with every other program, a requirement to attend placements with 1,000 hours. And I got really lucky with placements. I went all over the place. I did one in York, one in Leeds. I ended up at the Liverpool Chest and Heart Hospital on a specialist respiratory placement, which was exceptional. And you know, ordinarily we're not allowed to go outside of our practice area, but I made a little appeal to the university and to the Liverpool Chest and Heart, and they accepted me onto that. So I did that. And then my last placement was in critical care at York Hospital, which was kind of strange, really, because I'd spent the 3 years at university still working at the hospital. I was still working on COVID wards. I was still working in intensive care. And I spent a lot of time on the acute admissions unit as well. So it was a hospital I was really familiar with, and teams I was really familiar with. And it kind of, it dawned on me that this last placement was my last placement, and actually meant that my time at YSJ was coming to an end. My time with the boat club was coming to an end. My time in York was coming to an end, and to the hospital. And so it, in a really strange way, felt a privilege to do that last placement where my journey at York started. And so that was just brilliant. We did loads, and I've built up some really good friends. And even, you know, being the mature student kind of felt strange. And I was thinking to myself, you're 37 years old, you live in London, you're going to a university in York, and you're old. Like, what are you doing here? And I have to admit, the first couple of weeks did feel a little bit displacing, or you know, I felt displaced and a little bit strange. But to my absolute surprise and joy, YSJ actually have quite an affinity with mature students, and I wasn't the only one on the cohort. There was actually quite a gang of us, which was nice. And we sort of connected really well and established ourselves quite quickly as a team, sharing information and kind of practicing together and researching together. And that in itself became its really kind of strong, tight-knit group, which was brilliant. But I was also really surprised that the younger people in the cohort, and indeed across the university and the boat club, didn't really acknowledge my age and just took me on, and kind of I really felt part of the community, you know. And I think, unlike on my first degree, where I didn't embed myself into the student community and kind of embed myself into uni life, and realizing that that was a mistake and I should have just done that, I really threw myself into everything at YSJ, you know, not just rowing, but committees for this and having a go at that, and doing those ridiculous nights out in Cuda and Salvation, and just really got stuck in. And honestly, I had an absolute brilliant time. And it wasn't about being 20 again. It was about just saying to myself, this really is a brilliant opportunity, and I've got a chance to hit reset and build a new life. And I absolutely did, and I went for it, and I'm so glad that I did. And leaving York and leaving YSJ was a really sad moment. I thought I would be okay. I'd always planned to come back to London, and so I was going home, and it just felt strange. And I didn't want to leave YSJ, and I didn't want to leave York. And it was because of those connections that I built, and because of that community that I was a part of. And, you know, I'm sure we all agree it's a beautiful city and a brilliant place to be. And I didn't want to leave my beloved boat club either, even though I was coming home to row with my home club. It just felt a little bit strange. And it took me a while to settle back into London life, you know, and not just the crazy tubes and the madness and the ridiculous prices of lattes, but just being home again after being home somewhere else for 3 years. But, you know, I did settle. I'd started a job at Bart's Health, which is a huge trust in London, and home to the Royal London and the London Air Ambulance, and started my Band 5 rotations, and really just got stuck in, I guess, and kind of went for it. I was really lucky. I had a couple of rotations in neurology, so I was working on a hyperacute stroke unit at the Royal London. And I have to be honest, I wasn't really a fan of neurophysio while I was studying it. It just didn't have the same pull that respiratory practice did. But I honestly really, really enjoyed it. It's absolutely fascinating and such a challenge at the same time. I liked it a lot. I also did a rotation on the medical team, which is kind of bread and butter practice, I think, and everything we think about when we're physios on placements are kind of, you know, the general treatment, the mobility, the discharge planning, and all of those things. And then I took a chance, just as I did when I applied for Band 5 roles, and thought, I'm going to put an application in for a Band 6 role, just for the feedback. Hopefully I'll get an interview and get some feedback from that, so I can start preparing for Band 6 rotations at some future point. And I got really, really lucky, and I interviewed at 5 trusts, I think, and I got offers from all of them, which shocked me. I'd only been a Band 5 for kind of 13, 14 months. And so here I am now working as a Band 6 specialist physiotherapist, developing a specialism in respiratory practice. And I've settled very much in a home in critical care, having worked in ICU for such a long time now, working with some brilliant practitioners. And UCLH is a specialist in quite niche areas. So they have a huge research focus in oncology and cancer treatments. And so we see a lot of oncology and hematology patients, but also, you know, respiratory patients and cardiothoracics. And it's absolutely mind-blowing, the things that we do. And being a new Band 6 has been a bit of a challenge. You know, there's research projects to be involved in. There's staff management to kind of get stuck in with, and supervising while you're being supervised yourself. And it's been a little bit strange and a bit of a whirlwind. But I can honestly say, hand on heart, now I'm here, and this is my third career, essentially. I am right where I want to be, and right where I should have always been. I absolutely love it. You know, I wake up in the morning and, okay, sometimes tired, you know, it's working in a hospital is hard work sometimes, but I still wake up excited and I can't wait to get to work. I can't wait to catch up with the team and see what everybody did last night and tell them all about the rowing that I did the night before, because this is my life now. But also to see my patients and see what's going on. And critical care is a tough environment to work in. Things can change very, very quickly with your patients, and new patients coming in and patients going to the ward because they've improved and progressed and done really well. And no day is the same on ICU. And I think that's why I love it. And it is hyper acute and there's a lot going on, but we also get to achieve some really brilliant things. And I know it sounds a little bit daft, but the one thing I genuinely love about my job is the people, the patients. I love seeing my patients and their families and just being there with them. But we get to do some brilliant things on ICU. We're there when a patient is liberated from a ventilator and they're extubated and breathing for themselves again. And for those patients that have a tracheostomy in, we're there giving them their voice back when we're trialing what we call a cough down trial and a PMV trial, so a little speaking valve for them to be able to talk again, and hearing a patient's voice for the first time since maybe you've met them because they came in intubated, ventilated and sedated is just, it's amazing. And going through that rehab journey, you know, sitting people on the end of the bed sounds so simple and basic, but actually it's a brilliant moment because our patients might not have been able to do that for a long time. Getting them out in the chair, getting them walking again, it's just, oh, it's absolutely brilliant. I can't describe it. I'm so lucky to do the job that I do. And I think for anybody still not sure, if you're still kind of thinking of applying to be, you know, a physio student, if you're thinking this is the career for you, honestly just go for it, you know. And if you're a mature student, absolutely go for it. I don't regret a single thing. I'm really proud to still be a part of the YSJ community. I'm still involved with my beloved boat club, as I call it, you know, and I do my best to support the guys who are rowing there now and the captains and the committee. I pop up annually and try and fight my way into a boat for a race at York Summer. We've built an alumni community now, the 1852, which has always been around, but just needed that extra push. And we're trying to engage with not just my cohort and kind of, you know, the recent cohort, but people who rode with YSJ in the 50s, 60s, 70s, 80s, you know, let's go back. Let's make this big community that we were and that actually we still are and can still do. And it's just that again is a privilege, and I wouldn't have had that, I don't think, if I hadn't have come to YSJ. I wouldn't have had those opportunities. It's been absolutely fantastic, and I really am proud to be a YSJ graduate and an alumni and to still be here and still be involved.
Thank you, Benji. That was an absolutely incredible talk and really inspiring. And it's amazing to hear your enthusiasm for York St John and for your job and the career that you do. And yeah, it was just a very, very inspiring talk. So what I'm going to do now is I am going to ask you a few questions. I've written down a couple of questions while you were speaking, just about some stuff you said that I would love to hear more about. And then I am going to present to you some York St John related questions about your course and about the boat club, and also ask you some more career-based questions that maybe our soon-to-be graduates and our current students would like to hear. So a question I have for you, which I think this is quite a unique experience to you and your cohort particularly, is starting a program during the pandemic, which I was the same. I started studying during the pandemic as well, and it's quite an interesting time. I was wondering if you have something more to say, especially since you have studied before, obviously when there wasn't one. What would you say were the challenges, or what was quite unique about being a student during the pandemic?
It compared to kind of my first degree, when you just went to uni every day and kind of saw your mates and went to the library and had access to tutors and all of the things. And I think for me, as well as a kinesthetic learner, it's important to get hands-on. And it was a challenge, I think, to not have that and to not be able to build those relationships straight away. It was all a bit weird. We eventually bobbled because, physiotherapy, like all clinical courses, is hands-on. And so when we were able to kind of open up just a little bit and went into small bubbles of groups to be able to study, things made so much more sense than lecture notes being presented through Teams and just watching videos and slides and things. Although it was brilliant and we still managed to achieve and learn a lot, things didn't really kind of click in my head until I was there in a room and doing movements and seeing things. But at the same time, I think it's given us an opportunity, hasn't it? We've realized that digital education does work, and actually you can learn online and you can do these things. And I think not just for me, but for other students, I think it's taught us a thing or two about resilience and independence. And it really was a horrible time for everybody, wasn't it? But I think for those of us at uni during them time, maybe we've come out a little bit stronger. And for mature students, maybe a little bit more digitally astute. There's things you can do with laptops that I had no idea you could do. So yeah, it was unusual, but we managed.
I think that's a really positive outlook on that, because I think certainly the resilience that you had to build and adapt into the changes of moving to online learning, and especially with a course like yours, which is very practical and sort of still trying to build that community and gaining that experience. And it's really good to hear about about the community of the physiotherapy course, and likewise with the boat club as well. So that leads me on to my next question. You've spoken quite a bit about the York St John boat club and some of your achievements and favourite memories, but what I would like to ask you, is there anything in particular that any of your most favourite memories about being part of the boat club, or something that you were really proud of achieving during your time with them?
Yeah, I'm proud of every single day. I'm proud of every single session. But we did, as a leadership team, as a committee, achieve some brilliant things. We've got a massive history, and we wanted to celebrate that. And so we worked with the alumni team and creative teams at the university to produce essentially a timeline, a visual way of depicting our history and some of the great people who have been a part of our life at some point during their career. And that's now and this lovely thing up on the wall. When I popped up a few weeks ago, I was talking to Andy Robertson, who's now a coach at the university, and he knew people on that board, and that's just amazing. And occasionally we'll get someone walking past the boat club who kind of rode with us in the 60s or 70s or whatever, and they come in and you show them this timeline, and it's just this instant connection with people. And I'm really proud we pushed to get that produced, because it instills a sense of pride in us, but it still shows that connection with people who aren't in boats every day with us now, and that's brilliant. I had another crazy idea to produce a little kind of bumblebee superhighway, and I had a chat with the grounds team one day who were popping up to cut the grass, and said, actually, do you know what, we as a rowing club need to be more environmentally responsible. We're kind of afflicted by floods every year in York, and although it's a very small, tiny way of getting something done, so we opened up this wildflower garden on the grass instead, and kind of, we did a thing where we banned plastics and just thought about how we manage ourselves in a more sustainable way. And I'm really proud of that as well, because it got the university thinking about engagement with sports clubs. And one of the brilliant things about YSJ, it is sustainable. There's a genuine commitment to sustainability, and I wanted to be a part of that. And I think the uni were like, actually, yeah, you're right. We can all be a part of this. So that was brilliant. In our challenge to establish ourselves again and to get the equipment that we need, boats are really expensive, but we approached the student union and discussed those challenges with them quite openly. And all of a sudden, we opened up a subsection, I guess, a sports union, and we were the driving force behind that. If I'm being really, really honest, sitting down with the Vice Chancellor and having a cup of tea and explaining that I needed £10,000 to buy new boats, And then being given £10,000 to buy new boats was probably the cheekiest thing I've done, but also the best thing, because seeing those boats on the water now and seeing them being raced, it's like, yeah, I did that, and it should have my name on it. But we did things like that, and we did it as a team, and it wasn't just about us. It was about rowing goes on, and it needs to go on, and being the little force behind that was brilliant. So yeah, I'm proud of every single session and every single moment.
No, I do love. I love hearing the stories about the boat club, and I think especially known from the time frame that you were here, because that was when I started in the alumni team, seeing how much the team had built up the boat club itself, and for example the timeline on the wall, and the positive impact that has had on our alumni community, and the fact that that is available for alumni to come and see and to connect with the current members of the boat club, and it's just uniting current students and alumni. It's just really, really special, and it's really inspiring the work that you've done, and boat club members past and present have done as well. That sort of leads me sort of still thinking about rowing, but also thinking about your career too. Rowing is a big time commitment, and it's a lot of work. You've got to be very disciplined for it. However, the job you do is also very time consuming and, time heavy. How do you manage to balance your rowing commitments as well as your job commitment?
That's a brilliant question, and I don't know. I'm still working that out myself. Sometimes I ask myself whether I'm working to fund my rowing career, or whether I'm rowing to keep myself sane in my physiotherapy career. It is challenging, and I keep saying to myself, just one more season and I'll stop. Just one more season and I'll stop, and that's not going to happen. It just kind of fits. I think if you really want something, if you want to achieve something, you make it work. And while I was at uni, I was working, studying, rowing, still trying to have a life. And do all of those things in some weird times, and it happened. And kind of, when I came back to London and got back in a boat with my guys from my home club, it happened, and it fits around work. Being on call is a bit of a challenge, because I have to be close to the hospital, and so I have to skip sessions or change things around. I'm really lucky. My crew are really tolerant of me, and they understand the work that I do. So we adjust our training times a little bit sometimes. I've phoned my coach at 3 a.m. to let her know I've just done a 2K test in the gym at the hospital while I'm on call. I just do it, and it just makes me, and I love it. But yeah, it's a mission.
That sounds like time management skills and project management is very, very key in terms of making that work.
Yeah, I would say so.
That, I think, will lead me on to my next question, is what would you say would be the transferable skills that you learned from your course while studying at York St John, and how have you applied them to your current life, both in and outside of work?
Yeah. I think communication skills definitely, and not just because of the challenge in COVID and having to work with people in different ways, but being able to communicate in different situations, and engaging different styles of communication. We weren't necessarily taught to address and work with nonverbal patients, but simply giving an experience of that and a knowledge of that helps shape your practice. Digital communication, written communication, the way we have to write notes as physios is quite specific, and a legal document. We were supported with that. Project management skills, balancing assignments on top of clinical practice, on top of all of the things you do outside of university, is absolutely critical. And that is a really, really important skill in practice. Relationship skills, as I've said, is brilliant, not just with patients, but with the MDT. And kind of that starts on day one of university. And then I guess the things that I've learned from rowing as well, that kind of coaching skills that I've got and that I developed at YSJ as well, has been brilliant. I think everything we learn, and probably on every course, is a transferable skill. We're quite lucky, aren't we, in that our course is very focused and very kind of practice focused. So we're being prepared from day one, but those skills apply in all sorts of situations. So everything, I guess, from the experience at YSJ has set me up and is transferable.
Oh, that's so brilliant to hear. And I think it's really useful to share with our students that, the amount of different skills that you learn, both that you're very aware of learning and sort of unconsciously learning during your degree, and how that can benefit life outside, both in work and personal life, is really important.
Yeah.
So to sort of move on to the kind of postgraduate experience, my first question to you is, how did you approach applying for your first job as a physiotherapist, like post university? And what advice would you give to a graduate or soon to be graduate about preparing for an interview or applying for those jobs?
Yeah. Okay. My first piece of advice is don't panic, guys. We're all going through the same thing. There's no right or wrong time to start your applications. If you want to give yourself a break, give yourself a break. That's absolutely fine. If you want to get started straight away, then absolutely go for it. I took a bit of a chance, and I started looking at roles in London in January, February, so way in advance of finishing the course. But I just wanted to have a look and see what the situation was, and have a look at application formats and try and get my head around that. NHS applications are really quite structured, and on the one hand, that's brilliant because you've got guidance, but on the other, it's quite difficult because you have to do things in a certain way. So I looked at a couple of roles and a couple of trusts and thought, I'm going to practice an application on this. And I think that's really important as well, just to get the format into your head. Just give it a go. It doesn't matter which job or which trust. Just download an application pack, have a read through it, start practicing your statements. And that's what I did. And I applied to Barts on a bit of a whim, really. And it was just to get some feedback, and thought, you know what, I've got a few months before I finish. I'll get rejected, but at least I'll be able to get some idea of why, and then I can start preparing. Then when I am actually ready to apply, I should be in a good position. I didn't expect to get the interview, but it was kind of like, oh, right, okay, I'm going to have to change the way I do things now and start preparing for interviews. Your personal tutor and any of the tutors on the course are really well placed to help you with that, because they've been through it, they've been in practice, so they get it. And also, as a cohort, we were because we were all sort of moving in that direction together, we practiced interviews together. We were kind of throwing random interview questions at each other down the corridor on the way to our lab to do whatever it was. Take your time with the applications, read through the job spec properly. There's a really set kind of person criteria. And ultimately, what you have to do is tick the boxes on that statement. So read through each one of those elements and prepare even just a sentence to demonstrate that you have that skill or you've got that experience. But don't leave it at that, because you are not the only physiotherapy student. Everyone has the same qualification. Everyone has done the same number of placements with the same hours. There's one thing people aren't qualified to be, though, and that's you. So be yourself and make that application the human that you are, because when it really, really comes to it, your patient doesn't care where you did your degree or what qualification you've got. They care that you can work with them and that they trust you ultimately with their life or with their progression. So make that statement human and just go for it. And the same with interviews. There's a set way of doing interviews in the NHS. There's some clinical questions, there's some non-clinical questions, and a couple of random ones. Start practicing, start preparing. Be honest with your responses, but also be human with them. If you don't know, you don't know. That's okay. Maybe spin it and talk about how you might approach finding out, or how you might deal with that situation in real life, in real practice. And again, just go for it. If you don't get that first job, that's okay. Keep going. And the same when you're in practice. One of the best pieces of advice I've been given is recently with my supervisor, and that's that you simply cannot know everything about everything at that point in time. We're still learning, and that's okay. And it's the same with applications. You're still learning. You want to be the best you can be, and that's enough. Just keep going, keep developing. You'll get there.
I think that's absolutely brilliant advice for anyone to follow, regardless. That is, very, very important. I think I would like to sort of expand and ask a further question about applying for jobs post-graduation. Is what skills and experiences do you think graduates should emphasize or prioritize when they're thinking about applying for jobs as a physiotherapist? Is there anything in particular that you did that you think worked well, and that you would like to share?
I think, as I've just said, we've all done a similar thing and we've all done similar placements. Emphasize the skills you built during that particular placement and how you think that set you up for practice. I think that's quite important because reflective practice is essential to what we do. So if you're illustrating a bit of reflection in your application, that's a brilliant thing. The same with the kind of the soft skills that you've got. Don't just say you're great at communication. Tell me how. Tell me what experience you've got of that. Have you worked with non-verbal patients? Have you worked with a tracheostomy patient who can't communicate? That's brilliant. But if that's not on the application, it's not going to be known, is it? So just get that across. Also, think about things in terms of the pillars of practice. So education, research, clinical skill, all of those. Try and build those into the application if you can and demonstrate that awareness. And also don't be afraid to be ambitious. You know, you might not be working on a world-beating quality improvement project right now, but if you've done a bit of QI either at uni or on a placement, and some people are lucky enough to get that experience now, put that across, because again, that's absolutely essential at band 5, 6, 7, 8. So highlight that too.
No, that's amazing. I think that's really great advice. So again, to talk about the postgraduate experience, I was quite interested in what you said about transitioning from post-YSJ life, and I feel like that is something a lot of our alumni experience, as York St John has such a strong community aspect, and then to move on to wherever you go, whether that is leaving York or just sort of being outside of that university environment. What advice would you give to somebody who has recently graduated and is trying to transition into that postgraduate life, sort of outside of work? What advice would you sort of give to those people?
Just remember who you are and where you came from. YSJ's motto is live life abundantly, right? So keep that in your head and just keep doing that. Go for everything. And just like you did on that first day of uni when you didn't really know anybody, it's going to be the same on your first day of work, right? So do the same thing. Just get to know everyone, get stuck in and go for it. Remember the work that you put in to get to this point. Physio degree is not easy at all. You've done a lot of hard work already. Be emboldened by that and go for it. And if you miss uni, and I get it, I still do, and it's been a couple of years now, go back. The uni is always open. Go have that walk around. Go sit in the quad. Go get that coffee. Get in touch with your old mates. Go to all of the things that we do. You know, there's Old Johns, there's all sorts of stuff. You can still be a part of that community as much as it's part of you. I go back and go rowing. Whatever it is that you do, go back and be a part of it. But yeah, just remember who you are, where you came from. Go for it.
I love that. And as well, to sort of echo Benji, the alumni team are always here to give campus tours or run events to encourage you to come back as well. No, amazing. So I now want to sort of cast your mind back to your very first day of being at York St John. So like Benji, day one, year one, what advice or what do you wish you could say to your former self when they very first started university?
Oh, that's a good one, being the kind of the oldie of the group. I did everything on this degree that I should have done in my first degree. So if we approach it in that way, and it really is just to get stuck in. Don't be afraid of things and people and places. Just be confident, be bold, make friends, get involved in sports and societies and things, and take that campus tour. Get yourself booked in with a learning advisor at the library, because that's going to be important. Pay attention to the things that make it matter and set yourself up a structure quite early. Have study time, have downtime, have social time, but also be flexible. Things change. You might be struggling with one assignment way more than another. So it's important to have that kind of structure. Don't be so rigid. But as I've said before, and I'll keep saying, just get stuck in and go for it. It really is a brilliant opportunity and a fantastic experience, and it will stick with you forever.
I think that's absolutely excellent advice. That, yeah, I think, again, all of us should be able to hear. So, speaking of advice, I would like to ask you, from your time at York St John, what would you say would be the single best piece of advice somebody had given to you while you were here?
Oh, I was given lots of advice by lots of my tutors. Um, I think for me personally, I've got a really high bar. I expect quite a lot of myself. And I think as an older person as well, I kind of think, oh, you should be better than this. You should be able to do more. And I put myself under loads of pressure as well with being dyslexic. Um, and I guess it kind of echoes the feedback that I had from my supervisor just recently, is that you can't do everything in one go, and you can't know everything straight away. Give yourself time to develop. Don't run before you can walk, essentially. I think is what I was told when I was at uni. But enjoy the journey and the learning in the first place. And I have to remind myself of that every now and then, when I'm kind of working on a couple of projects at work, and I want everything done now, and I want to know everything now. And actually, it's not about the end game. It's about the bits in the middle that make all the difference.
I think that's really crucial advice, in that it is a journey and that you can't run before you walk. It is a process and you will get there. Okay, so I would like to thank you so much for your time. And before we end this webinar, I would like to ask you one final question. And that is there anything at the moment that you've been working on or excited about currently, whether that is work-related, run-related, life-related, anything?
It's me, so I'm working on lots of stuff. From a rowing point of view, I've got a massive race coming up in a couple of weeks. It's the first time that my club will race the British Rowing Senior Championships, and it's serious level competition. So I'm excited but incredibly nervous about that. I'm working on a couple of projects at work around quality improvement. So I'm on the delirium working group and looking at how we as physios can have some kind of impact in the non-pharmacological management of delirium in critical care, which is really important to me. And I'm also working on a kind of a standalone project around communication with non-verbal patients. So like tracheostomy patients who don't have a voice yet to be able to communicate. So that's great stuff. And I've just finished the first year, or the first element of a master's degree in critical care. And quite thankfully taking a little break from that, because that on top of everything else was just a bit much. But I'm certainly looking and excited about some more postgraduate study in the future. But yeah, there's always stuff going on with me.
That does not surprise me one bit, but it all sounds really, really exciting and really varied and keeping you very, very busy.
Yeah.
But yeah, so I will allow this webinar to come to an end. Benji, thank you so much for your time and sharing your experience both at York St John and now currently in your career. There's so many valuable elements to what you have said. I would just like to echo that if anybody has any questions for Benji, please feel free to email alumni@yorksj.ac.uk, and we would be more than happy to pass them over to Benji to answer, I'm sure. But yes, I would like to thank you for your time.
Thanks very much. It's been great to be back.
Yeah, bye.
Bye.